Hi there, Facebook and Instagram friends. Welcome to our Facebook Live on this very warm Wednesday. It's a perfect chance to talk about summer safety. I'm sure many of you were outside today trying to enjoy this weather, but will have some tips for you to how to make sure you're staying safe while doing that. With us today is Dr. Patel. Dr. Patel, many of our viewers may know you from your practice, but why don't you introduce yourself for those who are unfamiliar with you?
Perfect. My name is Vishal Patel. As mentioned, I'm a primary care physician at Christianic Care's MAP 2 practice. In addition to practicing clinically there, I'm the medical director of that practice, and I'm extremely excited here and delighted that you guys were able to invite me to talk about summer safety.
So if you guys have, before we get started, if you guys have any questions, please leave them in the comments and we may touch on them, or we'll get to your questions as well throughout the program. So let's get started. Obviously today is incredibly warm day. So we have our water here to make sure that we're staying hydrated. But whether it's 80 degrees or 100 degrees like it feels like today, hydration is really the key for safety in general.
And that's exactly what I preach to all patients of mine. Anywhere, if you're a kid to an adult, hydration is probably the number one thing to prevent any heat exhaustion. And especially on hot days like this, I really recommend carrying a gallon of water, because if it's 100 degrees out and you're outside for 4 to 6 hours, you should be able to finish this so that it can prevent any signs of heat exhaustion.
So what about alcohol or other beverages that people are saying, well, I'm still drinking, it may just not be water? What do you tell those patients?
So even though, most of, beers and other alcoholic beverages, some of them may be 5 to 10% alcohol, unfortunately the other properties of the drink is that it is a diuretic, so you end up peeing out a lot of what you take in, and not only are you urinating the water, but also key electrolytes that you need. So in anyone that's going to be drinking alcohol, I do recommend for every one drink to have at least one drink of some water equivalent, either being water or Gatorade. Great.
So we have our waters, our giant jugs, to continue staying hydrated throughout the day. Now, no matter where you're going, if you're going to be outside, sunscreen is incredibly important. So what are your recommendations for, what types to use? There are dozens of options in the store. How does someone know what to buy?
Great question. And we have a few sunscreen options here. And like I said, I think that the few things that are must-haves in any of the sunscreens is looking at having the words broad spectrum, and that covers both UVA and UVB rays. The second is having the sunscreen being water resistant, so that covers you for at least 60 minutes up to 80 minutes in terms of when you have to reapply. And then the third thing is looking at the SPF, and I recommend at least SPF of 30. Some say 15 or greater is fine, but because there's variation in manufacturers, I say go with SPF of 30.
And spray versus lotion, what is your opinion on that?
So, like I said, we have a few options here. We have both the lotion and the spray. I recommend the lotion, as if you're gonna just get one sunscreen for the whole family, you're gonna have better absorption and it's gonna protect you better. Whereas with sprays, when you're spraying something on, it may be a little bit difficult because a lot of it blows away. So I do recommend using the lotion.
And is there anything on the back, there's all those ingredients, some people read them, some people don't.
Correct.
What should we be looking for?
Great question. So the other thing is that most of these sunscreens, they're either chemical based or mineral based. And the key things that I recommend everyone to look at is the sunscreen have either zinc oxide or titanium dioxide? Most of them have zinc oxide, and for those of you that are parents with young kids, that's the same stuff that's in a lot of the diaper creams, and it's very sensitive to the skin. So I do recommend anything that has zinc oxide or titanium dioxide, because it's mineral based. It does have to be applied a little bit more frequently, but if you're applying it every hour, and it's just better for your skin from a sensitivity standpoint.
Great. So we have our water, we have our suntan lotion, sunglasses. I know one of our viewers had submitted a question ahead of time asking, how do I know? Some of them are cute, some of them are expensive, but what really matters?
So in a lot of this, as we mentioned before with the sunscreen, higher the number, after 30, there may not be much of a difference. So in that, higher may not be better, but with sunglasses, the larger the size in terms of the diameter, the more sun protection you get. So I do recommend a bigger size for the sunglasses for overall UV protection. And then the other key thing is looking at, a lot of the sunglasses have those little stickers that say 100% UV protection or full UV protection. So making sure that the glasses have that on there, and that will provide you the appropriate UV protection.
What about size? So these are mine and those are yours.
Yep.
And obviously size-wise, mine are a tad bigger than his. Does that matter, or is that what the trend happens to be that summer?
So if it is something where you have protection on the sides and they're bigger, it does provide more protection around your eyes. But as we'll talk in with other things that we need for summer safety, this isn't the only thing that's going to protect you. And one of the other misnomers is that both of our glasses are a little bit on the darker side. The size or the color of it doesn't really matter. You can have white sunglasses or you can have black sunglasses. If they have UV protection, they have UV protection.
That's great. So some people wear sunglasses and hats, some are just hats. What about hats? What should we be looking for?
So, obviously sunglasses protect you around your eyes. However, there's other parts of your body and your face that are important to protect. And, there's caps. We don't have any because we do recommend sort of full brim hats, because when you're putting them on, it not only is protecting your hair and your head, but then also various parts of your face, such as your ears and the back of your neck, so that you're not directly in the sun.
So to touch back on the sunscreen for a minute, should you make sure you're still, applying to your forehead and your ears and your neck if you're wearing one of those hats?
Yeah, I think depending on sort of if you have tons of hair or not, I think if you don't have that much hair, it is important to not only use the sunscreen on your head, but then also wearing the hat, because it's, the sunscreen may last for an hour. We know that even with the hat, you are perspiring. You may take it off for a little bit. So to provide you the full sun protection, it's important to use both the sunscreen and the hat.
Okay, so everyone for the most part has their water and their sunscreen, sunglasses, hat, clothing, especially for kids.
Yeah.
I know you have two small
Yep.
kids. How do you make sure they're appropriately dressed when you want to just put them on days like today and
Yep.
shorts and a tank top,
Yep.
as easy as
Yep.
you can? What do you need to keep in mind?
So, in terms of, I did bring, fortunately my son, who just turned 6 months the other day, because it was so hot today, they weren't able to go into the pool today, so I was able to bring his bathing suit. So, this is, if you're out in the water, doing anything where you're having full protection of their body, so not only protecting their entire hands and arms, but then also their legs, so that they have less exposure to the sun, because we talked about protection of the face with the sunglasses, hat, and the sunscreen there. And then if you have this, you're essentially protecting their whole body. And then depending on the age of the child, you can either put sunscreen or booties on so that you're protecting their feet.
What about adults? Sometimes we don't really think about that. If we're putting the sunscreen on, we think that's enough. Sometimes we're not. So when we're going out, whether it's the beach or to work on a day like today, what kind of clothing should we keep in mind?
So, in terms of overall protection, as much as you can cover your body in sun exposed areas, obviously you can't protect every part, and that's where sun safety and sunscreens can be helpful. So, a lot of women that wear makeup, there's a lot of sunscreen. Some of them are SPF of 15 and greater, some of them are SPF 30 and greater. So I think getting in the habit of wearing some of those skin products that have sunscreen in them, and then having that ability to reapply if you're going to be out in the sun, will protect your body. And then in terms of clothing, if you're out there in the summertime and it's warm, there are lighter colored clothing, maybe those that may be cotton based, that are a little bit easier to breathe in and can provide sort of the full protection of your arms.
That's great. So as you mentioned, your son's daycare chose not to do the water fun today, but I'm sure a lot of you out there have one of these in your backyard and we're thinking about doing this today or tomorrow, or maybe we're out in your baby pool today. This looks, relatively harmless. So many people have these, but there are some dangers to keep in mind. So what would you recommend?
We were using this like 2 days ago, and I think and I was cleaning it this morning. So I think it's definitely something that has a lot of fun associated with it, but as mentioned, there are some hazards and things to look out for. So, right now there's a little water in it, so making sure before you go in to remove all the water, clean it out.
A few bugs in here.
Few bugs and
already.
leaves and things like that.
Just put that in there a few minutes ago, and it already has bugs and leaves from this tree. So definitely keep that in mind.
Correct. Yeah. So I would remove all the water, and then clean it before you're going to use it. And in terms of cleaning, I usually use like a combination of 1 cup of bleach with 5 cups of water, and then using a rag or towel to clean that pool, and then obviously keep it in the sun for a few hours just to dry, and then you can put it away and then use it when you need it.
I know we've had a few people ask, this may be such small amount of water, but easily drownable.
Yeah. And the minimum amount to drown is only 2 inches, so 5 centimeters, so it's just a very small amount of water. So that could be in a little puddle like this, it could be in a bathtub, it could be anywhere. So I think having close supervision with any little kids, especially if a kid's like 6 months to a year and they're just starting to crawl or walk, it's extremely important for having adult supervision at all times.
And what about, the big kids, once they're in the community pool or in the big pool, what should parents just kind of basically, when you go to the community pool, what should they keep in mind?
Great question. So the CDC has a catchy logo. They say to keep the poo out of the pool. And that's really saying that if your kid's having any GI illnesses like diarrhea, vomiting, to just stay out of the pool, because we don't really want to put any germs in the pool. And then around that germs, we want to make sure that you're showering or at least rinsing off before going in the water. So any either bacteria or anything that you have on the body, you're not putting into the pool. And then, if your kid is starting to potty train, or even if your kid is potty trained, making sure that at least every hour, maybe even more frequently, to ensure that you get the kid out to go pee outside, use the bathroom outside, so that they're not using the pool for their bathroom.
And even just making sure you have everything we've already talked about in your bag to reapply the sunscreen and that kind of thing.
And I tell a lot of my patients, if you're going to be at the pool, a lot of people now have smart watches. Unfortunately, neither of us have right now, but you'll have like an Apple Watch, and you could just put an hour timer, and during that time period, you can get your kid out, send them to the bathroom, you can reapply the sunscreen, you can drink some of the water, and if there's any other things that you need to take care of during that time period, you can, and then go back to having fun.
But it's also important, if you're pulling your child out of the water to do all of those things, that you're also doing all of those things.
Yeah, so the same thing, once everyone's there, you can have multiple water bottles for everyone in the family. Obviously, you can have one sunscreen, you can apply it to each other to ensure that you're getting their backs on other parts of the body.
That's great. So, as we mentioned earlier, there were already a few bugs in this pool. So kind of let's transition a little bit. I know we're getting questions in always, every year, about all sorts of bugs. There's the mosquitoes, there's the ticks.
Yeah.
Should we be using the candles? Should we be using the spray? What do you recommend?
So one of the things that I recommend is using any sort of insect repellent. And, most of these have DEET in them. And DEET helps to it doesn't kill off the insects, but it helps to repel a lot of the insects and ticks. It doesn't do that for bees and other things like that, but I do recommend using DEET. And this is safe for anyone above 2 months of age. And in terms of, similar to how we talked about SPFs, you could buy 15, 30, 50, over 50. With DEET, it comes with different percentages. I think if you're going to use it for the whole family, anything between 5 and 10%, a lot of them have 10%, is really helpful. It works for about 2 hours, and it's relatively safe.
So say you're out in your backyard having a barbecue, you're using this, but you still have a bite. You don't know what kind of bug it was.
Yeah.
When is it at the point where they should come see you about it?
So, obviously, the most of the bites and insect bites that you get are likely not going to be related to a tick. It's just going to be a mosquito, and you may have a local reaction, so a little redness at the spot, and then it may last for a few days. And I think if you start having more systemic signs where you're having fevers, areas of that wound or that bite where the skin's open a little bit, or you're starting to have fevers and they're not really responsive to Tylenol, those are all times to come in because that bug bite may have led to a skin infection. And then I guess the other part of the question was more around, is if we're concerned if it's a tick. And we know where we live, being in a wooded areas, ticks are very prevalent. And in terms of tick prevention, especially with kids, a lot of the things that I tell a lot of my parents is you're giving your child a bath either every day, every other day. So that's an opportunity for you not only to look at all their clothes, but then also their whole body to see if there's any ticks there.
And what if there is? What should they do? When should they come see you? How should they monitor that?
So, if you do see a tick on the body, you can use tweezers, or some sort of forceps, or you can, come to see us either at primary care or one of our urgent cares to have it removed. Typically if you can get it removed within a day and a half, the likelihood of developing Lyme or any of the sequelae from that is very unlikely. So there is that time window where if it's there, you can remove it. And essentially, if you have something there, just using upward pressure. There's various different videos out there, and I'm happy to share a few of these videos in our comments section so that you have like an evidence-based way of how to remove some of these ticks.
That's great. So we've been out here roughly a half hour, and thankfully we're in the shade, and because it's later in the evening, it's been hotter throughout the day. But say you're a construction worker, you're working outside all day, and you're in the prime time for heat and the sun. What kind of things should you be looking out for? And you have your sunscreen on, you're drinking your water, but you still feel kind of off. What are the warning signs for things like heat exhaustion?
So in terms of heat exhaustion, the early signs are going to be some signs of dehydration, some signs of you're a little foggy, a little bit slower. You just may be feeling a little off, you may have a little tremor. You're just not able to get your work done at the same pace as you were previously. And then as things sort of progress, the symptoms get more severe, where you may start having episodes where you're almost passing out, or you pass out, you may black out. So we're hoping that if we catch some earlier signs where you feel a little bit off, a little bit more tired than usual, that you use the water, take a rest, go into the shade. A lot of these workplaces have cool mist areas to help you sort of rehydrate. And
at what point do they need to say, I need to go see someone?
So I think if we see that some of that progression where they have that mild confusion and then leads to further confusion, or almost passing out to passing out, any of those signs where it's deteriorating pretty quickly, I would say to get to go to the emergency room, because you're going to need some IV hydration. You're going to really need to cool down. And on some of these sites you may be able to check one's temperature, but sometimes it may be difficult. And if you're completely passed out, it may be difficult for you to drink water by mouth. So you'll need other treatment options.
And at what point is it, I need to go see my primary care provider, or I need to go to the emergency department?
So, great question. In terms of heat exhaustion, it's tough because a lot of the treatment options may require IV hydration. And in current state, most of that is provided within our emergency room setting. And some of our primary care, urgent cares don't have that capability. However, we're available 24/7. So even if you have questions regarding to that, if someone at your workplace wants to reach out to us, we can help guide you on what the best treatment option should be for you.
That's great. What other topics? I'm sure you see hundreds of patients and deal with a lot of topics. So just real quick before we wrap up, is there any other topic relating to summer that you're seeing a lot of this year?
So I do get a lot of questions around when should I start swimming, when should I put my kid in swim classes, and then what sort of flotation device should I use? So those are things that I, especially as new parents and going through it not only as a physician but now as a father, things that come up. So that I usually tell people that swimming classes reduce one's likelihood of swim-related injuries or death by almost 100%. There are approved flotation devices or life vests that you can purchase on Amazon for 100 or for $10 to $15, and that is a lot better than any of the floaties because that gives a false sense of security. So I would say those are big topics that come up, especially because everyone joins pools and swim clubs during the summer.
That's great. Well, if you have any other questions for Dr. Patel, please leave them in the comments and we'll be able to get to your questions in the comments after we wrap up today. And if you are looking for a primary care provider such as Dr. Patel, we have so many primary care providers in all of your neighborhoods. So just go to christianacare.org and you'll be able to find the doctor that is best for you. Thank you so much for joining us today, and please stay safe this summer.
Take care.